I think a few of you on call. So for those of you who don't know me, I mainly do hospital medicine. So you'll see me on there. I also do a clinic for child and family. What my work life is that I'm actually 30% clinical. So I have the title of clinician educator. I have my master's in health professions education through Chicago. So happy to talk about those kinds of training routes. And what I focus most of my academic work is around leadership development, especially in residents and students. I look at feedback, and I'm immersed in looking at CanMeds and competency-based education. Some volunteer stuff that I do in the educational realm is I'm involved with the Canadian Association for Medical Education, for those of you who don't know it. I'm also the CAME Foundation board chair, and you all are members of the Manitoba Pediatric Society. So I'm one of the executive members. I'm also happy to talk to people. My husband's an adult gastroenterologist in the community. We have 2 children, so happy to talk about balancing that kind of environment. In terms of if you're interested in doing research with me, or if I could help you in any way, I do mixed methods research, so qualitative and quantitative. I have some experience with surveys, focus groups, interviews, and the types of questions I ask, just to help you understand what that means. So I look at how the team, learners, teachers, the system can do better. I look at what their experiences are, what their perspectives are of these various groups, including patients. So that's sort of me in a nutshell. I don't know if there was questions for clarification around that. Right?
Do you have any particular topics you would like to teach from these bright minds?
So I'm part of, so you can ask Gina and Carrie Lewis. I'm part of Gina's research team. I'm Carrie Lewis's supervisor. So Gina's working on how we can improve psychiatric or mental health care for children. And Carrie is looking at designing a chief resident assessment tool, actually, that we'll hopefully implement across Canada. So a lot of my focus will be going back to looking at actually leadership education is what I focus on. For those of you who are interested in developing curriculum, I'm involved with an international group that's working on developing residency leadership curriculum, as well as resource stewardship, quality, etc. So that's sort of, so I'm not planning on starting anything new, but I do know that Carrie's going to be designing the tool, and then we are looking to actually implement it. So during the implementation phase, which will probably be sometime next year, we would be looking for another resident to potentially collaborate with us. So, and potentially probably take the lead, because she'll be immersed in exams and starting her practice. So that would be my only specific. Questions on that?
I have a question regarding,
Yeah.
not so much the research, but how you have a 30-70 split. So not specifically how is that funded, but how did you make that happen?
So it was a very gradual process. I'm not really, so I have some titled roles. So I'm the director for faculty development for the department. I'm the assistant director for the IMG program. So those I guess director titled roles can often come with a stipend. But a lot of to be very honest, and I'm not sure you should tape this, but I think in education it'll never be equivalent. So if I were to work clinical work, so there is a pay cut for me in particular, and a lot of the work is, I guess it's part of my academic work, which actually is not paid. But I mentioned that I'm married to an adult gastroenterologist, and I'll, be very honest, life is, as a physician, we all do very well, but as a 100% clinician, there certainly is no worries from that perspective. So, but I think when you're if you're the single breadwinner, that's something that is a consideration, and something to factor in terms of career planning. But at the end of the day, my title was job and calling. Like, this is something I'm very passionate about. I really love what I do. So I'm willing to, I sacrifice to a certain level. Yeah. So I call it the sort of the nitty gritty. I know you all have done your TIPS course, or not TIPS course, but the teaching modules, so you all finished those. And so this is sort of to get you into some more hands-on and sort of some practical tips that are going to be useful for you. You're all going to be teachers, you're all learners. Currently, you all may have led in a certain functions, and you're all followers around projects, initiatives, etc. So some of the things we're going to be looking at is sort of characteristics of what I mean by effective feedback. We'll talk about some of the common problems of why it's actually hard to do, and we'll just touch briefly on the distinction between feedback, assessment, and evaluation that also gets lumped, and then you're going to have lots of time to practice. So, I want you to think for a moment of the last time you received feedback or gave feedback, and then you need to find a partner in the room to discuss it. You can work in groups of 3 if you like, or somebody can go and talk to Celia or myself.
They all gave feedback yesterday.
Sorry?
They all gave
it? Excellent.
They
Okay.
gave.
Yes, and how was that experience?
So that's for...
Yeah, good to know. Started practicing. So we'll see. You'll get to grade yourselves later today as how that went. Okay. So maybe outside of yesterday, unless it was astonishingly spectacular or a dismal failure. Otherwise, talk about maybe in the clinical realm when you last got feedback or gave feedback.
Maybe if you were sure that it started with
So if the other person hasn't shared, you should switch. So can we come back together as a larger group? So you all received feedback yesterday. So who talked about in your examples that you shared, who's had good experiences with receiving feedback? Sort of, okay, maybe half, but some of you haven't, okay. Who's had bad experience with experiencing feedback? Okay. So what was some of the good, what was some of the bad? It can be a story you heard or a story or something you've experienced.
I would say that not a bad experience where it's harmful to me, but I've had a lot of experiences where the feedback just isn't that useful.
Okay.
Okay, if this hadn't have happened, it would have been there's this opportunity for something.
Right, nothing's changed, yeah.
Okay. Walk out
okay.
That was a nice talk for 10 minutes.
Right, but not very helpful to you. Okay. I see a lot of nods around that.
Okay, from my experience with the past 3 months with the feedback, they would ask me, what do you think went wrong?
Right.
And I would say I did this and this and this and not in a proper way. And then I would ask them, what's your feedback? And they would say the same thing.
Okay.
So I'm not
they kind of regurgitate.
Yeah.
Okay. And did you come up with a plan to make things better together?
I'm trying to improve it.
Right.
But I'm not sure if they noticed it in the beginning.
Okay.
So if I did...
So at least they agreed with you.
Okay. Really in touch. They took your suggestions on your feedback.
Right. Okay. And then after that sort of encounter, did you come up with ways that you can improve those things that you were concerned about?
Yeah.
Okay. So that's a positive aspect. So it was kind of a mixed experience. Was there other stories to share?
You were talking a little bit about feedback that comes out of the blue a little bit, and you're like, oh,
Okay.
I don't know if that's a good experience or a bad experience, but there certainly received some feedback that either that wasn't my intention or no one has ever told me that before. So
Okay, so it was a surprise?
Yeah, and I don't know if there's this was after a week, sort of the end of the rotation, and so
Right.
it's kind of here's your feedback, okay, bye. I'm leaving, or they're leaving, but I'm not.
For sure, we're trying to, there's the times when like you're gonna be told something maybe you should have been told years before and someone finally says something and you catch on and it's great and it's useful. But
Sure.
then there's the kind of feedback that's actually a personal attack or
Okay.
attack on your personality or those kinds of things, and that's not helpful, nor
Right.
is that something you can change.
Sure, much harder to change for sure.
Yes, and in some
Okay.
cases maybe it was a misinterpretation, that there was no discussion, it was more of a talking act versus a.
Okay, and so there wasn't any opportunity to have a dialogue, so
No.
that two-way street is important, is what I'm hearing. Okay, was it also, do you think part of it is the culture that we don't do it enough? And was that part of why it was unexpected or out of the blue, or was it just that it was something that nobody had ever said before?
I think it was like something no one had ever said before. I don't think it was unexpected because it was sort of, we were sitting down.
I see,
feedback.
okay.
I do think that's an important point though, in general, when we talk about feedback, we're in a world and a discipline where you're always trying to be the best or you're always hoping to succeed. And
Right.
so we're not, I would argue, taught to be very good at both giving and receiving critiques or suggestions.
Okay.
Because that means you're not perfect, but we're not perfect. So we should, you know what I mean?
Okay,
But I think
yeah.
that's-
I
Yeah,
don't know if it's true that we don't like give or like receive feedback often enough, because like every
Do it all the
2
time.
weeks is how often we're supposed to
Yeah.
actually get it, which
If it
seems like often
happens.
enough. It's just whether it happens and whether it's productive and whether.
Okay.
What it said is the same as what's on it.
so I would argue with you, though, you could probably get it every day and give it every day. So that's the difference. You're right. By, rules, you have to have it at least midway. But there's no reason, like, why would you wait 2 weeks so first of all, if it's something serious, you're going to say something right away, right? Or you've been told something right away. You hope. But there's no reason why it can't happen actually more frequently. So sometimes I think the surprise comes because if you're waiting till that 2 weeks, there might be lots to say and then it's kind of hard to digest, or it's something that you're either not interested in, so it's not actually meaningful to you, and it can be a bit of a surprise, so kind of off the topic, so. And yeah, definitely any of those that are kind of geared towards your personality aren't going to be that helpful at the end of the day. So what about as a provider, what were some of the stories?
I think it's really hard to give feedback
Okay. Why is that?
when there's lots of things.
Sure, yeah. So when you wait those 2 weeks or 4 weeks before you say anything, okay?
Or someone isn't open to it. So like, I can think of the example you're thinking of. And they weren't really open to it when the time came for evaluation, but they certainly weren't open to it every day either. So
Okay.
it's kind of if the person you're giving feedback to has no interest in receiving, it's kind of like in normal medicine, if someone doesn't want to talk about something,
Right,
right? Like
right.
just-
So how many of you are musicians? Okay, a few of you are sports artists,
Oh,
musicians?
I think he's a magician.
No, well, you could be. Well, that would be cool. I'm recruiting for a busker festival, yeah. So what about sports? Did you play sports as a kid or still play sports, right? And do y'all have coaches?
Yeah.
Okay, and so how often did your coach give you feedback? Right? Like sometimes every minute, right? So if you think about it, we actually grew up and we're used to getting it every day, yet or you give it if any of you have coached, and yet it's such a different culture in medicine. So anyways, just something to think about, and it's something to think about our receptivity.
I was thinking about that because I coach skating and I think
Yeah.
it's different. Like
Sure.
I'm very comfortable giving feedback about technical skills.
Sure.
If there's like not necessarily a correct way to do it, but the way that I want it done is this.
Right.
Here's some tips on how to get it done in the like positive like correction with what you want rather
Right.
than just focusing on the negative. But in medicine, I find a lot of the times it's more not personality, but like personal skills or dealing. It's a different type of feedback.
Okay, so it's not just about their knowledge, it's
Yeah.
maybe about their communication
Yeah.
style or other elements that are equally important.
Right.
So let me ask you, as a skating coach, is it harder to give feedback about artistic ability? Because that's your interpretation, do you think? Or is it the same as technical skills? Just curious.
I would say they're not different. I mean, they're different things, but I think you talk about them equally.
Okay.
And then some of the team dynamic stuff, even there, I think I was just less comfortable with it, but you knew it had to be done or else something.
Okay. So I mean, I think, I think in the medicine and even the healthcare culture, we're just, for whatever reason, we're not as receptive to it. It doesn't happen on a regular basis, so it seems a bit foreign and unusual, even though in the rest of our lives, for most of us, in various aspects where it's happening, more than on a daily aspect. So just something to think about.
I think in medicine, a lot of times people we often are on this rotating schedule, and people say oh, I wanted to get to know someone, or wait to see more before I tried to.
You don't want it to be a one-off.
Off the boat.
Yeah.
But then so many of our experiences are a one-off that it is no, that might be what is needed.
Yeah, and I think the problem is everybody thinks that.
Yeah.
Maybe it's just me, and then nobody says anything. And I'll tell you an anecdote. I once had to sit on a committee. It wasn't for another program, for somebody in a remediation, and it was they were a senior. And if you actually looked, people would kind of write comments. If you read between the lines, they would kind of write things, but nobody actually either gave them a poor grade on their assessments, and they didn't really talk to this person. So they didn't know for years even. And now they're in this serious situation where they were in remediation and probation, and it was it's sort of a pity, I think, if it kind of takes, because everybody kind of said, well, so somebody else will deal with that, and I don't think that's fair. Certainly not fair to our patients and their families, if you think about it. So never mind to that individual, and to everybody else. So.
I'm finding I've been getting some of the best feedback from senior residents on call.
Yeah.
You, especially the screener, you deal with them the most, and every time you present to them, I've been getting a lot of more technical feedback, of questions I missed, or different approaches to dealing with, word pages that are coming up that I found really helpful, kind of from the front of the line experience.
Right. And I think one of the things you hit on with that particular group is they're actually able to watch you, and you spend time with them, right? So you have a bit of a relationship. That's why some of these one-off occasions, I struggle, because sometimes when students come to me, they only come for 3 hours, and that's it. I never see them again. And it's kind of okay, how do I actually even establish any kind of relationship so that they would care what I have to say? So I think on call, especially the night float person, you really get to know them after a while. And personally, one of my best friends is actually my senior from being on call as a resident. Yeah, we still keep in touch, and there's that kind of rapport that develops and that connection, and you really kind of trust what they say.
Yeah.
I think sorry.
Go ahead.
I think being on the receiving end of stuff, it's nice to get I think it would be better to get, oh, this is something you changed, this is what you did, do this next time, rather than, not this is how you made it, not that it has been, a list of things over the last 2 weeks that you did.
Right.
That to me is more hard to swallow, rather than at this moment, this is what you did, this is what you could do.
Right.
So I think as much as maybe people don't want to give immediate feedback because they're waiting to see if you do the same bad thing again, it doesn't seem fair.
Either, yeah.
I feel you should just address it, say do this instead, and then.
And plus you remember it, right? How many times when you're oh, which patient, when did that happen? Who are you talking about? And that's kind of frustrating.
You remember.
Yeah.
Why don't you just tell me at the time?
Right, yeah. And sorry,
I
Robin?
was just going to say, with the on-call feedback too, I think one of the more unique things is, the screener is seeing the patient.
Yeah.
And then you're seeing the patient.
Sure.
And you're kind of comparing the information that you've gotten.
Yeah.
And sometimes if you miss an important piece, you get some, it's less technical and more of this is how, communication style. So this is how I elicited this piece of information.
Yeah. So on that note, and it's slightly tangential, so the way I teach now on my teams is I actually have any asthmatic or respiratory thing, I have them listen concurrently. Because you all know where the student comes to you and asks for help, I don't know what I heard, I'm not sure how to describe it, but when you listen, you're hearing something different. So if it's not at the same time, especially with respiratory, heart murmur is going to be the same, but respiratory, you kind of got to listen at the same time. So that's kind of one trick to make sure when you're actually giving the feedback that you're actually observing the same thing. Because otherwise, after the fact, it'll be different. So, and we all know one cough and the kid sounds different, right? So, yeah, that chest, yeah. All right. So I need a volunteer for a fun exercise to kind of hone some of these things. It's not painful. You'll have to leave the room and go down the hall for 30 seconds while I prep this group. You're gonna go? Okay. So I'll take you out.
You'll take me out.
Don't take a chair. Well, no, I gotta prep you and then I'll prep them and then we'll bring you out. And then you just keep.
I like knowing what the game is before we play.
I volunteer for, the last time I volunteered gladly was when Dr. Bucco had me work the defibrillator, so academic half day. No,
So I'm looking at the search and learn topics and I'm looking at PubMed. So me, Jesse, Suzanne, and Robin do that only to find the topic. Okay, is that right? Or did you say do something?
no, I didn't.
So we need her, Suzanne, to find something. What should we have her find in the room?
Let's have her lunch.
Well, you can't move anything. It has to be something in the...
Tim Hortons cups or something like that.
Okay,
Oh, our chocolate you went to.
okay. I can't even see it. All right.
It's big.
Okay,
She'll find it.
okay.
Oh, yeah, that's a good.
Yeah, that's
All right. Well, don't move it though. You have to put it back.
What, you want to put it back?
No, yeah.
In there?
Yeah? Yeah, see how observant she was? Okay, so, this is gonna how we go. So for the first little bit until I tell you, you can say nothing when she comes in. She knows she has to find something, but until I tell you to go, you can't say anything. Then, as she's moving, she's gonna move around looking for something. The only thing that you can say to her for the next little bit is no. Okay? And then I'll cue you again. You can say to her no and yes. Got it? I'll cue you for every time. I promise you, it'll be fun. Okay. I'll bring her in. All right, come on in. So they haven't moved it. It's something in the room that you have to look for. And I'll let you know when you can start asking questions. But you can go around the room and try and find it. Okay, now you guys can cue her with no.
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 No, you can't say other things. Okay, now you can say no or yes.
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 No.
Yes.
Okay, now, Suzanne, you can ask questions.
Is it in the cupboard?
No.
Is it the ceiling?
Can I say more than yes or no when she asks a question?
No.
No.
Yes.
You found it?
Yeah.
There you go, I didn't even hear her. So how was that when you first came into the room and was looking for something and nobody said anything to you? How'd that feel?
Not ideal.
Kind of useless,
Kind of
hey?
useless, but I knew that I couldn't ask and I didn't know what I was looking for. So
Right.
Kind of was just in pause, I guess.
Right. Couldn't really achieve much
No, like I
at the
was walking
time.
just to walk.
Sure. Okay, all right. And what about when they started saying no?
It was amusing, but, well, not that helpful, but also has a negative connotation to it.
Sure.
So it was interesting.
Kind of being berated, right?
That if my heart rate was being measured,
Yeah.
like increased slightly, even though it was all.
Yeah, they would, I watched her and it looked like she was like kind of jumping sometimes when you would like say no really loudly. Okay, what about when they started saying yes?
Um,
How'd you feel?
yes. better.
Better? Easier to
A little
hear?
bit more helpful.
Okay.
But still not really like it led me to still have to figure out what.
Okay. And then what about when you're asking questions?
Again, a little more useful, but having strictly a yes or no wasn't as helpful as
If you'd been
being
giving some specifics.
or even like the tone. Maybe.
Okay. And what about for you guys? What was that like, not being able to say anything?
It was like weird.
Hard work, huh?
Watching her.
Anywhere.
Okay.
A little strange.
And then, what about when you were able to say no or yes?
You guys are really excited about saying no. Just for the record.
That was only like 10 seconds, by the way. It wasn't very long. The whole exercise took like a minute maybe to do. Okay. And when you could say yes, that feel better?
Yeah.
Or when you could answer specific questions? That was the best. I guess if she, ultimately, it's kind of hard in this exercise to give specific feedback, so hopefully that kind of honed in on some of these things. So just to recap, the specificity, you talked about being descriptive, the timeliness. I think one of the key things that Duncan really hit on was sort of that whole thing. It has to be based on observation. So sometimes when you use a surrogate and you weren't in the room, it's not really useful. You can't really tell people how good they were at communicating if you never heard them talk to a family. That whole thing about being limited you brought up, I think that's key. Like you can't like give a whole shopping list. People stop listening after probably one or two. And you kind of need to kind of check in and make sure you hear them. Like when you talk to patients and families, you kind of check in, you verify that they understood what you said, and you kind of do the same thing. And we'll talk a little bit about documentation. I think the other key piece to highlight is really that learning plan. Now you had mentioned, I wish they'd just given me a couple of things and then told me how I could do better. I think that's one style. Other styles that you might want to think about is actually you being involved as a learner to make the plan, come up with ideas. So it should be a joint process once again. Because it might not work for you, and truth be told, like if this is the art of medicine, people are all going to do things slightly differently. I'm sure you've seen that already in 3 months. There's slightly different styles, and you want to take the best of what you've seen. Just to highlight again, it is probably one of the number one requests, and at most accreditation times, many programs get dinged because people aren't getting enough feedback, and that includes actually for your teachers. So when you don't fill out your forms or give your rotation evals, programs can get dinged for that. So it is important, and it is a challenge to give. I help run the transition to senior, so I'll be seeing you guys again. And then I also I co-lead the Canadian Pediatric Resident Leadership Conference that happens primarily for chief residents, but others are welcome once a year. So it's probably the number one pick. So even at that senior level, they're still finding that they're struggling with feedback and looking for tips, as our faculty. So some underlying themes. We talked a little bit about this, is kind of credibility and trust. I think we highlighted that when we talked about the on-call example. So the credibility has to do with whether you think they know anything about what they're giving you feedback on. So, are they actually good at what they're giving you feedback about? So the last thing you want to do is somebody you feel is a poor communicator talking to you about your communication skills, as an example. And then trust. Did you think that the teacher and or the leader actually wanted to help you improve, right? And I think that's the sense of an on-call. They're really on just in time, kind of getting you to take it to the next level. And I think that whole sense of that relationship comes into play again. And that's in a paper by Telio and Friends from 2016. If you look at the current standards for accreditation in your Royal College program accreditation, these are all musts, so you must get feedback. They must happen at midway. It must include a face-to-face meeting, and it actually needs to be based on observation. And then the last must is what I talked about, that you actually have to give your teachers some feedback about their performance. And I will say that people respond when you fill out your forms, because teachers don't get invited back if there are issues with their teaching skills. So they do have concrete value. So I mentioned we touched on the differences. So feedback, I mentioned it could happen daily, fairly regular basis. It's about performance, and the intention is to guide and coach you to actually improve. Whereas an assessment is already a judgment, right? This is at the end of rotation, and it's all linguistics, but in the literature, if you're going to look at, when we say assessment, we're talking about us as learners. When we talk evaluation, they're just talking about the same judgment, but on how a teacher has performed or how the rotation or a program is doing. So that's just language, and truthfully, we use assessment and evaluation interchangeably, but you'll just, if you look in the literature, that's how they kind of divide things up. So it's somewhat semantic. So how are we supposed to do it? I think one of the key things we actually miss, so it's in this kind of model way to think about it, the first piece is actually to set expectations. So when you don't actually figure out what you want to focus on as a learner, and that's why you're the session, the rotation, etc., everything always has some objective, so you actually know what they're thinking as a teacher. But you really want to kind of set some of your specific expectations as well, and that's a key piece. And you should do that at the beginning of whatever orientation. Sometimes when I start these sessions, I actually ask people, well, what are you hoping to get out of it? If I don't know the audience that well, because then I can tell them I'm not going to deliver on that, and so they're not disappointed because they had this idea that I was going to talk about something in particular. And then the other piece we don't actually do well in this loop is we're not very good at observing. So we say that people can do histories and physicals by how they present the case to you. So truthfully, we'll need to actually be watching people do X in order to give them any feedback. And of course, you've got to have that actual encounter. So just writing it down somewhere and then emailing it without that opportunity to dialogue is not really that helpful either, which we didn't actually talk about, but sometimes that's an example that's given. There's a whole slew of models. This is probably the newest one, and I'll give you a handout that the authors gave me. So it's called R2C2, and it's just a mnemonic for the way to remember what you need to do. So in this, the first R is about rapport building, so that whole relationship, that trust. Exploring reactions, this is going back to people's self-assessment, checking in that they heard. You want to explore things together in terms of the message, and then you actually want to think about it as being a coach, or that you view the person who's providing you feedback as your coach that's intending to help you. So that goes back to that trust issue again. This four-step mnemonic is easy to think about it, and I like thinking sometimes like a red light, yellow light, green light model. So this is called ARCH. So A is for this asking for self-assessment. You always want to reinforce, so green light is keep doing something, yellow light is make a tweak, and then red light is, you need to stop, you need to correct. And then H is for helping the learner follow up with the plan. And all these will be, all the slides will be sent to you. So they're just different frameworks. The TDP programs probably gave you others to think about, and so it's just a healthy way to kind of help you remember it. Some documentation tips. Sometimes because it's hard, it's helpful to get organized, especially if it may be a difficult conversation because they don't have any insight or you have some things to correct. I like to kind of write it down and kind of prep what I'm going to say. Think of my specific examples that I have. Just use some standard outline. There's lots of different ones. I like using the canned meds, which kind of follows your current ITERs, and use that. As mentioned, at minimum, it needs to happen at midway and at the end. If there's quite a bit of corrective stuff, I actually have them sign it. I print out a copy at some point, and actually, that's just not that they agree, but that they received it. So there's no he said, she said, or I didn't get this message before.
I have a question about using like a framework like Canvas or feedback. I understand how it makes sense because you're evaluating all the different competencies.
Yeah.
But sometimes for a more person-to-person interaction, it creates these there's actually not that much that I want to talk to you about under this heading, and then you end up going through it and
I think
the conversation away from the actual areas where they could.
If it's just one area, I think sometimes they're like, well, why are you telling me this? Especially for those people who don't have insight and it's about what they consider a soft skill, okay, so everything but medical expert, then what it is, it kind of brings it back to this is how you're being assessed. So that's where that framing is useful. I completely agree. If it's just about the professionalism, you don't have to go through the whole schema. But if you're kind of struggling, what is it that I'm struggling with, and I need to give them feedback, and how do I organize it if there were a couple of points, then this using some kind of framework can be useful. So that's all it means. But yeah, for sure, if it's just focused on one role or in one particular area and it's clear, it's your communication with families, and you have some examples, just talk about that. But it's, they're like, well, why should I care about that? Then, in your back pocket, just say, remember, this is what you're being assessed on. This is a CanMeds role. It's a communicator role. So that's just something to hone in. Because there are a few people who are kind of like, I don't think this is important. And so that's just kind of a reminder tool. And then, sorry, go ahead.
I feel like too that it's important to document also because not so much, I don't think for any of us, having actually know us, but there's things that some people will do, and then if they keep doing it, it snowballs into bigger things, bigger problems, which inevitably end up being really big issues. But if you haven't been documenting all the small things, the first time there's a bigger issue, some people will say, well, we've never heard about this before. Obviously, person X could never, when really if it had been documented the whole time, hopefully someone would notice, but if not, when the big thing happens, at least you can then say, well, clearly they were never being respectful to other colleagues, therefore, and I think that's important.
Yeah. And, usually I tell people to give opportunities for them to comment. So they may disagree with you or want to write some comments. The signature that you have is mainly that they just are agreeing that they've received it, not that they agree or disagree. So those are some tips. Questions or other thoughts? Alrighty. How are we doing for time? Excellent. So you are going to divide yourself. Would you like to watch a video? We have time. Okay. Let's see if I can get this to work. And then we'll play bingo. So do you want to take one of these and pass it along? And you can take a handful of these and pass it along.
These like are little.
That's so fun.
Oh, that's hilarious.
We touch them, okay.
It's not recognizing your disc, Celia. Or the, it should play DVDs, right? It's telling me to insert one. I do.
Maybe in terms of what you, can I just cancel it?
Sure.
So maybe,
Yeah, I know.
so but maybe what it needs to do is when your computer needs to, it's your removable disk, because that's.
No, it's in the DVD.
It's in the DVD. You need like a paper or something?
No, it's just, it doesn't like to pop open.
Sometimes there's a little hole and that you can like paper clip it open.
There's a whole hole.
Yeah, sometimes. Oh, now it says it's.
Is it reading? Yeah, you're welcome to have a mint. Although chocolate's probably more exciting.
Smells like it's recognizing it. There you go.
All right. And do you have media player on this? There we go.
There is an autoplay on the CD itself.
Sorry?
There was an autoplay on the CD.
Was it? Okay. Let me see.
Go back.
Autoplay?
Autoplay? Oh.
No, I think when you went back to your list, it had some.
Right click.
Open.
Because you had a list.
Right.
So go to your list again.
No. It's it might not, it's a very touchy, technological failures.
So now the green light is flashing, so
Okay.
it's recognizing it.
And when it goes to autoplay, it'll let me play a chapter because we're not watching the whole movie. All right, just play?
No, run autoplay.
Oh, okay. This one?
Yeah.
No,
No.
and right click on it,
Right click.
Play?
play. Or play with VLC, either one of those and see where
Yeah.
it goes.
Should go. Maybe they,
Yeah.
No, You don't want to download it?
No. So how will I pick?
Maybe in playback, you can choose the chapter.
It doesn't look like it's.
There's a,
in the-
I know
Yeah.
it doesn't say go under play and see whether or not it's.
I don't know if it's recognizing it.
No, I get it.
Oh, there we go.
And then down here.
Yeah.
Oh, so
I
There
need
you
to-
go. Then you
all
want
right,
scene
scene selections. All right.
Select all.
I know. How many of you have seen?
Is this the first one?
Yes.
Is it really sad that I haven't seen any good pictures?
I have only seen it on there. I've never seen it like
You know how far along.
It's chapter 15. That's
yeah.
the
Watch the beginning.
I know by chapter.
Maybe if you right click on it and it goes
Yeah.
Playlist. What playlist do it? I'm trying to find chapter.
Which chapter?
Chapter 15.
That is a track. We were in Europe when I realized that Andrew had noticed.
You guys haven't seen the hell?
And so then I made it.
Oh my god!
because you have this down as far. Do you know roughly what minute?
Of course. Okay,
Oh, so it's starting to play there.
In the forums.
You just watched them?
Last night, I watched the second
So
one.
when I was in high
Oh
school,
my lord.
my friend and I were very confused. I had a friend who's like, we're gonna watch the whole Bourne series. And this friend was sometimes flaky and said, one. And she's like, okay, I have to go home. Just like, what? I thought we were watching all of them. I haven't watched them since. Why did I watch them?
Wait, can you go to? Can you? Could you go to like playback and choose the title now? Now that it's loaded.
Playback.
There.
Oh, there we go. There's chapter.
Oh, chapter, she wants chapter 15.
Chapter 10, right?
15, is that what you said? Oh, no, type
15. Yeah,
15.
15.
Up, there you go.
Perfect.
Oh, I
Now let's hope it plays.
still haven't seen.
Now the question is, where's the sound? Oh, no sound.
I've only seen the original.
The one that was first out was in 4 o'clock.
Okay, this is in chapter 15 though.
No.
It isn't.
But if you do it again when it's like full screen, it should
And the
work.
reason we watched them was
On playback?
No, no,
Playback,
chapter.
Title?
Or chapter, there is chapters.
There's
chapter.
and we wanted
There is some chapters, but if you want some
Star Wars.
It might be.
So this to me looks like
Is that what you wanted? And then you want to make it full screen.
I have watched really all day.
This isn't quite right either.
If anyone wants to know.
You know what's
But you can't watch the first.
Watching Titanic.
You know what's one of the highest growth?
Too far or too
And you
I can't.
actually change halfway through because that's how long.
Yeah.
Yeah, this isn't the right. Well, I think we're gonna have to abandon because I can't find the.
What scene are we looking for?
Where he's fighting with Neo when they're doing a class.
What you doing?
Yeah,
It's like, it's probably somewhere in the middle.
yeah.
There.
back
It's in
up.
the white, go back, it's when he's in the white area.
I know. Oh, absolutely. That movie made $1 billion.
In this?
Maybe 4.
Yeah.
But the last one called kind of $1 million. There's more. It's just like
There.
it's comical with the stunts.
Like the six.
Okay, and then let's hear it.
Flying off a bridge and it just happened.
Okay, we've got our scene. Is this it?
Yeah. So you're supposed to use your bingo card. You use the candies to mark what you see. Turn the lights up.
Good. Adaptation, improvisation. It's your weakness, it's not your technique.
Who is fighting Neo?
Do you believe that my being stronger or faster has anything to do with my muscles in this place? You think that's air you're breathing now? Again.
All right, fun's over.
Well, it's set up 3.
Yeah.
Almost got a line.
Almost got a line. So what were some of the things that
Anytime written on that.
the coach in black gave the student in white?
Verbal feedback?
Okay, so it's verbal,
Private setting?
Timely,
private, okay,
probably immediate, correcting errors.
Self-assessment?
face-to-face.
There was a midway evaluation?
And an opportunity, they were actually observed, opportunity to improve, right? Yeah, because I think that's one of the
There
tough
was a
things.
learning plan.
Yes, sometimes the problem is you don't get a chance to be observed again, right? Like, those are the worst moments where you get told something and it's like, oh, but I'm done now, how am I supposed to improve, right? So he got a chance to improve again. Okay.
Concrete examples and abstract.
There was some concrete examples. What about the good? Is that nice to hear sometimes? That's kind of non-specific. Is that useful at all? That was the first word, right? Was good. Okay.
It doesn't give him any information on what was good.
Sure.
What is general abilities?
Then they said it had nothing to do with, I guess they said that his technical skills.
Global feedback, right?
So he followed it up, right? I think sometimes it is useful to actually make some general comments. What do you guys think about, so in this scenario, you guys brought up that, it's private, you're in a quiet space when you're giving it. Actually, it wasn't that private, he was being watched. I don't know if he knew that. But he was actually being watched by a whole audience. What do you think about giving or getting feedback in a group setting? Like on ward teams or something? Okay? Yeah.
Yes, sometimes the feedback does apply to everyone.
Okay.
And so Suzanne brought up that was a reason, when everyone can learn from it, I think there is value in telling it once to everyone.
Sure.
Rather than having to tell, or wait for every person to do that mistake and then correct them.
Okay.
But then at the same time, a lot of the time, the private setting for something, for more of the critiquing and things to work on, works better for sort of social psyche or self-esteem for other people.
Right. And yesterday when you got feedback, was it just one-on-one or did you all have to give it as a group? Yeah. So I actually, as a student, and then I went back as elective in London. At the time, it was Tim Fruin. He was the department head, and he ran academic rounds. He used to keep one resident from each level, and then they had to stay and give feedback to the presenter. And it would usually appear, so these were resident-run rounds that he as the department head attended, and then he would give feedback, but then everybody. So it was kind of a public setting, but it was meant to be an environment it was friendly, you all knew each other, and you kind of had to practice giving feedback, and the person had to sort of receive it in a public way. So sometimes that's a useful model, and those of you who've been on wards with me, sometimes I'll just kind of ask the team to kind of dissect how rounds went, and everybody's in the whole feedback process. So it's not about me talking, but everybody's kind of getting feedback because they'll bring up, I wish this had happened, or this was really good, we should have changed this, and